Greetings, everyone. We'll get started in just a moment and allow a minute or so for people to sign in. Okay, welcome everyone. In the interest of time, we'll go ahead and get started, and other people can join as we go along. Welcome to our 5th webinar in the Improving Data Use in Immunization Supply Chain Management webinar series. This webinar will cover data technology applications in cold chain management and immunization supply chain management. Today's webinar is being recorded, and we'll share the link with you in a follow-up email, along with the presentation slides and other resources. I think many of you already know me. My name is Greg Roche. I'm a Senior Technical Advisor with JSI, working in supply chain and capacity development, and it's a great pleasure for me to be with you here today. We're also joined by several panelists who will be presenting tools that they have developed for use in cold chain equipment and vaccine supply chain management. May I ask each panelist to introduce himself? Matt?
Hello, everybody. My name is Matt Morio. I work with PATH out of the Seattle office and focusing on immunization supply chains and systems.
Thanks very much. Brenno?
Yeah, Brenno Horst, working as the LMIS technical lead at the HISP Center at the University of Oslo, based in Norway. Thank you.
Great, thanks, Brenno. And last but not least, George.
Good morning, my name is George McGuire. I'm working with Brenno at the HISP Center at the University of Oslo as the ELMIS technical advisor. Thank you.
Great, so welcome again to you all, and thanks for joining us. And some of you may remember Matt from one of our previous webinars, Managing the Inventory of Cold Chain Equipment, way back in January of 2021. This webinar will actually include some updated information from what Matt presented last time. As we said, this is the 5th webinar in the current series. You can see the previous topics here, and the 6th webinar will be presented in May. We'll give you more information about that at the end of this webinar. As always, you can use the chat function to introduce yourselves to each other, maybe tell your colleagues your name and where you work. And we will leave time for questions at the end of the presentation. If you have a question during the webinar, you can ask it by using the Q&A button at the bottom of your screen. So let's move on to our webinar. We'll quickly review the objectives of the webinar. So today we hope to identify a variety of data applications used in cold chain management and immunization supply chain management, describe how cold chain data can be used for cold chain management, describe considerations and lessons learned for selection and implementation of data technology applications, and describe how cold chain equipment data can be triangulated with other data to inform decision-making. As a preview to cover the webinar objectives, here's the order in which we'll cover our topics. After a quick reminder, we'll hear from Matt about the CCIS platform. Then we'll hear from Brenno and George about DHIS2. Then we'll review data triangulation in the context of cold chain equipment data. And finally, we'll have the question and answer session. So as a quick reminder, if you attended or viewed our previous webinars in this series that we mentioned a moment ago, you might remember that we talked about a few data collection and management tools, and we want to remind you of those here. We previously looked at VIMS, SMT, and Viva, each of which is used to manage and analyze different data related to our vaccines and our cold chains. We will include the links to the previous webinars in our follow-up to this one so you can review those tools in more detail. Now I'd like to pass to Matt, who's going to be talking to us about inventory system, or CCIS. And it looks like Matt has lost his connection. So let me skip ahead to the DHIS. Apologies for this. The connection must have just gone out. Let me go through quickly. I'll find the DHIS. Oh, and now Matt is back. All right, let's, sorry about that. Let's go back.
Hello, sorry about that.
That's all right. There we go. All right, so Matt, can you please explain the CCIS?
Sure, thanks. Sorry, my little computer issue there. Yeah, so we had launched what is called the CCIS, or Cold Chain Inventory System, in Uganda just this past year. And the purpose of it is, as many of you know, cold chains are the backbone for a strong immunization system, especially for the storage and transport of the vaccines. And conducting an inventory is a time-consuming and costly activity that is often quickly outdated, if not outdated as soon as they're completed, just because equipment status changes and things are always kind of moving within the cold chain. And so having an operational view and something that we can use data for action with was one of the goals of the CCIS app. At the bottom there's kind of the standardized data, getting more effective reporting and sharing of data, not just reporting up to the central or national level people, but pushing data back down to the cold chain technicians to make it useful, and having that being consistent and near real time. Also, interoperability was a big thing. And so the CCIS is using a lot of the same data standards as DHIS2 and other platforms out there so that we can make sure that that data is interchangeable. Next slide, please. So, ODKX, a lot of you have probably heard of ODK, the data collection tool, and this is more of a complementary platform, not a replacement. The main things of it is it allows for a two-way synchronization versus just sending data up as you can with ODK. ODKX allows data to be synced back down to different devices as well as upwards, and creating similar custom workflows and screens. It's been around for about a few years now and has been deployed in over 100 countries for different instances. But this is the first one for a cold chain or inventory specific app. Next, please. So just a quick overview of the project itself. We did a pilot back in 2020, started in 3 districts, and with the help of University of Washington in Seattle and PATH supporting UNEPI, it proved on the right side some great results just within the first 30 to 90 days of, almost 80% of the facilities were updated, and almost, same for the number of refrigerators. We were able to extract a lot more granular data in terms of the maintenance records, the types of activities conducted, the spare parts consumed, as well as just some of those charts there showing the types of activities, as well as some temperature logging. So after a quick pilot, it was decided to move forward and scale this across the entire country of Uganda. Yeah, thanks. Unfortunately, a pandemic happened right there in the middle. So we had a little bit of a 2-year break. But again, the objective was then to deploy the application and system across all 136 districts of Uganda, conduct a full inventory to update that, and then use the data again just to improve and strengthen the health care system through the cold chain, making sure the refrigerators are working, and also tracking the deployment of a lot of the CCEOP equipment that would be coming into the country during this time. Next, please. So really quickly, just the structure of the data in the app and the system itself, it's really driven from the health facility level or whatever facility level we're at, if we're at the national store all the way down through the regions and districts. But that data comes from the DHIS2 master facility list. So we have good integration there. The next layer on top of that is then adding however many cold chain equipment are in that facility. And then within that, we have the maintenance logs, the moving of the equipment, the status of them, as well as recording temperature data. Next, please. So these next couple slides are just some screenshots of some of the fields available for, again, facility. We're taking a look at everything from the DHIS2 data, facility name, catchment population, GPS coordinates, et cetera, as well as any just programmatic data that's available. Next slide, please, Greg. As well as then, once we have that equipment in there, we can start collecting maintenance records, both preventative and repairs. And those are separated. And so then the users can select the type of activities conducted. In this example, for preventative repair, in the middle, you can see the type of activities. So the user would then, tick all the boxes that are applicable, as well as any notes. If it was a repair, a different screen would come up with the type of repair done and where, as well as another screen to collect what type of spare parts were collected. And then one other nice thing about this is anytime we do a maintenance record, if the equipment is under warranty, on the very first screen, it flags the user that this equipment is under warranty, for example, brand new CCEOP equipment, and to contact the appropriate warranty provider, which captures the name and number of the local service provider for that as well, just to make sure that the warranty is being honored, and also to track the data so we can say, on this date, at this time, we contacted the warranty provider. There's a record of it in the app, and then we can see how long it takes for them to respond and repair the equipment if needed. Next one is, again, temperature monitoring within the application itself. Because we're associated to each refrigerator and each facility, we can then collect basic temperature data in terms of the number of alarms, days above and below 8 degrees or 0 degrees. And there's also the ability to download directly from a fridge tag 2 and store the daily temperature data with the application, again, tied to each refrigerator and facility for interrogation and extraction, as well as some just dashboard alarms and things like that too. Next, please. So finally, this year in January, we were able to launch the application at scale. At the bottom right there is an image of some of the temperature alarms that were reported after deploying. Again, maintenance priority, we can flag that. So the technicians or managers can see where there's refrigerators needing repair, also by make and model, kind of assortment of those. And then the top screens are just some of the screens within the application itself. Next, please. So how did we get there? And early in January or mid-January, we did a training session of doing getting 25 super users or trainers available who would be leading the training the following week. Went through a lot of practical exercises of what and how the application works and when to use it, as well as making real life scenarios to work with the app. And it was really great to see. It took about a day for us to kind of all get familiar with the app and how it was working. And by the end of the second day, everybody was teaching each other and showing them tricks within navigating the app. And just a great group of trainers, which we went to the next slide and turned that into training over 150 district cold chain technicians and cold chain assistants. The super users were broken apart into 3 rooms of just around 50 each, covering the goal and purpose of the application itself, which were, again, getting an improved and real-time inventory with visibility across not just the central or national level, but all the way down to the technicians. Keeping the cold chain management and temperature monitoring, which are growing in importance. So making sure we're downloading all that stuff and reporting it in a standardized form, and then digitizing the maintenance and repair activities so that we can then look at the data afterwards and understand if there are any trends or patterns in terms of to help budgeting for spare parts and maintenance as we look forward. Also, again, just how do we use the app and syncing the data up to the national level or to the servers, or not national, et cetera. So over the 2 weeks of the deployment, we trained the 8 National Medical Store technical staff who are responsible for the server and the maintenance of the technology side of the application. The 25 super users for training of trainers the week before, and then we then did the 167 again technicians the week of January 22nd to 25th over 2.5 days. We distributed over 150 phones to the users with the app preloaded on it, and then also loaded on about 100 personal devices because it's an Android-based platform, the application as well. Next, please. So what does that mean, and what are the results from that? And just within our first month of February, we were able to show that almost 160 facilities were updated, 370 refrigerators were updated, and 56 district cold chain technicians had used the app and synced new data to the system. Again, and that's 28 days of February. Of that, within the equipment itself, 230-ish refrigerators were flagged as needing maintenance. And then the breakdown of that were 96 for now functioning but needing attention, 82 were not functioning, so needed attention, and then 56 were awaiting decommissioning. So even taking that data point and getting more granular to understand where to prioritize efforts and what's going on there. From the data, again, 35 technicians were able to record temperature data, and that map to the right shows where temperature alarms were showing up, again, high or low. 96 alarms total logged, again, there it shows. And then, the part that I'm most excited about is the maintenance logs. So we were able to get a handful of maintenance logs in there, 66 of them, and 20 spare parts consumptions tracking. So again, after a few months of this, we're going to go back and look for trends to see, are certain make and models going through a specific part more often. Some of the things that a lot of us, I think, sense or know, but there's no data behind it. So that way we will have a little more to at least present forward when coming to budgeting and planning. Next, please. So we've got a few months left on the project, and we're going to continue monitoring and supporting the use with the district cold chain technicians and the management. We'll have the national inventory completed, and then start again looking at the temperature data and the maintenance data for any trends that we can help refine activities or focus action. And also just building upon the dashboard we have, the initial thing, and getting feedback from the users of what's most important for the central level managers, but also are there things like quick reports that we can send to the district medical officer that the technicians are creating on their own, or things like that. Next, please. And so for the future, again, where the app is going, I think it's proving itself so far to be a great tool and useful. So looking for additional countries to pilot or deploy at scale. We're refining the different modules within there, especially kind of like, again, making some canned reports so the technicians can send a report to the district medical officer instead of having to fill it out by hand each month. Also looking at if there's ways to improve stock management, which I think the HISP guys following have some great solutions. So how can we integrate into things like that, or not recreate the wheel? And then also looking into areas that we could also use this for different asset management and inventories in primary healthcare, or diagnostic tools or things like that. So I will pause there. I apologize for the technical issue and going a little quick, but welcome any questions in the chat. Thanks.
Okay, thanks very much, Matt, for that great overview. If you have a question specific to CCIS, you can put that in the using the Q&A function in Zoom, but we'll come back to questions later in the presentation so we make sure that we have time to cover all of our guest speakers. So let's go now to George and Breno for DHIS2.
Great, thank you, Greg. Thank you for organizing, and great presentation for Matt. That was great to hear. So then I'll be going through cold chain monitoring using DHIS2 Capture app and the Blue Maestro Bluetooth temperature sensor. And slide. So I will start with a very broad introduction first to DHIS2, and then we'll go into the more specific use cases and then the way forward. So I'll hand over to George halfway, who will continue with some of the specifics. So quickly to present DHIS2, which is a platform for capturing, managing, and analyzing information. It's a generic platform with a wide range of use cases. So it's not only for health, and it's an open sourced also platform, so it can be easily downloaded and installed and implemented. There is a cost of ownership. There's a cost of installing and maintaining and running that. However, the software itself is open source and free. There's a web-based version and also an Android mobile app, which is the Capture app, which I mentioned in the start. So these are the two ways that you can input data, analyze, and sort of access the platform. It's highly extensible through web APIs, and Matt also referenced the integration in Uganda with the facility, the organizational unit structure. So that's one of the very many different integration possibilities, and that we're based at the University of Oslo. So the core software is being developed here at the University of Oslo, where George and I are working. However, it's implemented by many different HISP groups, and this is part of the HISP network, which actually supports organizations and ministries to implement and run the software. So next slide. So key use areas, again, HMIS and health information is the key area in different health programs, but there are also different different use cases within logistics, water and sanitation, forestry, and many others, being that it's a generic platform. Yeah, next slide. And there's quite a broad global adoption in 60 different countries at a national scale. So at least in one program working directly with ministries, and then piloting and expanding in different areas as well. Of course, the entry point is often, most often the health information system. And from there, we can build out different features. And this is where we've led to then the work, which we'll get into, which is the LMIS work and then cold chain. Slide. The development has been progressive. So it was not an overnight, what can I say? It wasn't an immediate success overnight, but it was gradual and progressive work over a long period of time, building on both an academic and research component, which is part of the work here again at the university, and then slow adoption and improvement of the software over quite a few years to reach this scale that we're at now. And we're looking for the same progressive approach, really focusing on the end user needs and building that slowly but steadily into the software to respond to those needs and building on those real world implementations. Slide. Quickly to mention the DHIS2 data models is a slight digression, but important to understand that you can have report-based data. So this is aggregate data. So reporting on a daily, weekly, monthly, or other period that you want, report data on events that you've captured. So for this purposes, it would be, for example, reporting on temperature data every hour or daily, or however often you would report it, or on stocks. There's a anonymous event data. So this would be one use case would be, for example, tracking an outbreak where you have a specific event, but then also used in some specific instances for stock management with the movement of stocks from one facility to another. And then we have our tracking model where we have longitudinal data connected to an entity, oftentimes being a patient or a client, but in our instances, it could be a piece of equipment, so cold chain equipment, a sensor, or a product like a vaccine. So these are the three native data models that we have within the platform, which then can be configured in many different ways to meet different use cases. Slide. And as part of the system as well, we have quite a developed analytics component, which we're able to build these individual graphics, which you see both different types of charts with different data and bringing together, again, stock and cold chain data comparing that with health service data, and then also overlaying that in maps and having different layers of data from different sources external to the system as well being analyzed. And these can then be targeted for different users at facility, district, or national level for analysis and decision-making and corrective action. Slide. So now the evolution of DHIS2, as I mentioned, being very much anchored in the health information system. But once countries began implementing and using it, given that it's a highly configurable generic platform, it was often used also for stock and cold chain management. And this is where individual local solutions were being developed. And the work that then George and I began from January of last year was really consolidating the different use cases that we found within this DHIS2 environment and developing some best case scenarios and prioritizing some further development within the software to meet these use cases and finding where the best position was for the software to be within this environment or this sector. A slide. So quickly, here is a snapshot of the functionality that we're then currently developing. A lot of it is available and some of it is under development, and that we're piloting and testing to ensure that we can meet needs and gaps in the sector. So the focus is then on end user solutions, so facility level solutions, which can then be integrated with central level systems, national level systems, both for cold chain management and stock management, and responding to very specific user needs, perhaps being in low resource settings, and also where you may not have a dedicated person working specifically with stock, cold chain, but rather a health person with multiple duties having this as an addition. So we're trying to map and adapt the workflows, the data flows, to minimize the amount of work needed to actually capture this data, automating as much as we can, and then integrating with central level systems. And then more specifically in this presentation, we'll go into the cold chain management with the temperature data monitoring. Slide. A very brief overview also of the integration architecture that we're looking to within the health information data on the right side, on the right column, you have DHIS2 often being used at all levels for capturing data in multiple programs, whereas for the logistics information, LMIS, cold chain included, we focus on the community health worker, hospital, or health center, so this end user level, and then having some form of integration with a central level system. So we're not looking to overlap or compete with existing solutions, which there are very many fantastic solutions out there, but rather targeting where there's a gap and a need for further to further support these operations at the end user. Slide. And then finally, being able to bring this data together, both stock data, cold chain data, and then analyze that to be able to inform corrective action at the district or facility level, and then for analysis at a central level. If you go on to the next slide, we also have an example of then comparing, for example, doses administered versus the amount of stock that has been issued, and see if there's a large discrepancy, if there's some need for either investigating if there's some issue with the data capture or with the service delivery or some other problem to explain why there is such a huge discrepancy between these different data sources, which otherwise may be in separate systems, a purely dedicated logistics system and a health system. We try to bring then this data together for triangulation. Next slide. This is the same then for an immunization program, also incorporating wastage rates, which can show the efficiency of immunization at a site. Slide. And then also having an overview of stocks by facility when we're using this for stock data capture. And I think this is the last slide, and then we go over to, presenting the data over a map for availability of stocks by facility. And then we transition to then the cold chain monitoring app, CCM, which George will present now.
Okay, thanks a lot for the invitation and possibility to present. Next slide, please. So the problem statement, so the requirement or use case is that you need to monitor the temperature in refrigerators, mainly for vaccines, but also for other drug supplies or sometimes vaccine freezers. Have a record of the temperature, and what is really important, to ideally have a real-time alert, especially in case of freezing, so that storekeepers have an immediate alert and can take corrective action. And our solution is to use a Bluetooth sensor, a data logger that you place in the refrigerator that is connected in ideally in real time to a mobile phone, and that logs data every 10 minutes with alarms, but also will prompt an alarm on the mobile phone in case the alarm limit is exceeded or too low. So these are some examples of DHIS2 capture app mobile applications for different HMS applications, but just to show, it will basically be one of the module like any other of the DHIS2 apps. Next slide, please. This is just an example of showing how DHIS2 is actually used in the field with one of our Android developers. Next slide, please. So this is basically our kind of technical concept. So on the left side, you have the Bluetooth temperature data logger that records the temperature every 10 minutes, could be every minute. It is a BLA, Bluetooth low energy sensor that is synchronized with the mobile app that is basically a DHIS2 integrated in DHIS2. So you will not need to have a separate application on your mobile phone. Vision is to have everything work in DHIS2. So on this mobile phone, you can collect you can then be alerted to alarms, you can monitor your temperature. And then once a day, for example, you can synchronize your mobile phone, the database on your mobile phone through a Wi-Fi network or to the DHIS2 central server and collect all the data on a central server for the country, for each of the devices, and then also have centralized analytics. Next slide, please. So temperature alerts, as I mentioned, vaccines, of course, very sensitive to freezing, especially to temperature excursions, to high to low temperature, but especially they're very quickly damaged in case of freezing. So you can set, rather than collecting the temperature twice a day, you'll have a data logger recording the temperature every 10 minutes, every 5 minutes, even every minute, and basically instantly alerting the storekeeper in case of temperature excursion. And you can then also record the number of alerts per day and save them on the server. Next slide, please. So quality assurance, it's also important to have a record of the temperature throughout the lifetime of drug products, ideally from the manufacturing site until the child is vaccinated. So we would cover part of that. So you monitor the temperature every 10 minutes, you have a record, you can record the minimum, maximum temperature, let's say, of the day, the number of alerts per day, and then keep a permanent record, because keeping a record of readings every minute, roughly calculated, will require like 500,000 data points per refrigerator, which is a huge amount on the server. So one of the workarounds in basically to consolidate all this data is to calculate the mean kinetic temperature on a daily basis, which basically represents the damage done, potential damage done to the vaccine in a single number, and store the daily mean kinetic temperatures on the central server. Next slide, please. And the next further use case is the biomedical engineering quality monitoring. We call it life cycle management, where you basically can follow a piece of cold chain equipment from the time of installation, then the commissioning, the testing, doing the initial installation. Then you have like a service record, preventive maintenance, also maybe daily equipment checks by storekeepers or by non-technicians, then a record of the repairs that were done, and eventually of the decommissioning, together with a record of all your equipment, like an inventory, and keep that record permanently on the server. Next slide, please. These are just some quick examples of what can be done with very simple dashboards. So this is very simply, let's say, the number of alerts, the number of times that the cold chain was breached per month. Next slide, please. Then you can also display this on a map. So as a biomedical engineer sitting at the district level or capital level, or a company in charge of servicing equipment, you could see a map of the devices, cold chain equipment, which are prompting alerts and how many alerts they prompt. Next slide, please. And this is another potential representation, which simply displays a number of temperature alerts. So you can have this by facility, by district, at the country level, with a number, eventually the duration. To have an analysis, you could do this analysis also by type of equipment, for example, to detect equipment that is particularly susceptible to cold chain failures. And back to Breno, thank you.
Okay, thank you, George. And I just have 3 final slides to wrap it up. Just to quickly mention, though, before I continue, that the last analytic slides, which George just went through, are actually being used now. Mali, Togo, I think, also Guinea-Bissau, and a couple of other countries are examples where they're using not this automated solution which we're developing here, but rather just aggregate reporting that people type in the data. So this is already in use. The analytics are already partly in use by ministries. And then what we're looking to do, as I mentioned before, is automating and improving both data flow and workflow to better match the requirements for this end user level. So if we then go to the way forward in the first slide there, we're then running right now a pilot in Mozambique and Zambezia province, where we're in 4 facilities with a few devices in each one, just to confirm the ability of this custom app and this sensor to work together and meet the user requirements. So both how does it suit the workflow for the health worker at a facility, and does it feed the correct data to both have the alerts and the historic data as George presented, and does it actually respond to that requirement? And then fine-tuning all of these configurations and ensuring that it works smoothly and that this can be easily scaled up. And this is hopefully a next step within this pilot. And then again, it's capturing exact requirements, improvement to the dashboards and analytics, because we don't want to, again, simply capture data for the sake of capturing data or creating work for a health worker who's already has enough to do with the health service delivery, but to ensure that you have actionable data and that you have corrective action stemming from the different data and alerts that we develop. So that's another key part of it, is the data usage aspect of it. If we go on to the next slide. So the benefits that we're looking at for the solution is really having digitizing and automating a lot of the workflow, which oftentimes is paper-based, and even within DHIS2, as we mentioned before, is inputting manual data, but rather automating a lot of that work. Some of the advantages are also the low cost of the hardware. The sensors are around $35 retail price for a low energy device. The software, so the DHIS2 software is open source, as I mentioned, and it's very much leveraging, which is another important aspect of the LMIS work that we're doing in general. It's leveraging the existing implementations of DHIS2, countries that have already the infrastructure, the devices, knowledge when it comes to thousands of health workers and users that are familiar with the application. Adding an additional screen or module is a low barrier or low threshold to then be able to bring this usability and these features to the users. And then finally, it's the integrated approach. So both having the analytics and all of this other data already within the DHIS2 platform, but also to say that this can be, and we're looking to integrate with other platforms to ensure that if it's the WHO SMT tool or whichever other tool that might have similar data, again, referring back to Matt's example with the organizational unit data from DHIS2, that we can share easily the data from what we capture at facility with other systems that might be needing that same data to provide analysis and corrective action and so on. So on to the last slide. So then for the future the previous slide, thanks. So for future enhancements, it would really be confirming the viability of this use case with this pilot, and then incorporating this as a core piece of software, which is natively supported by DHIS2, which is then part of all future updates, making it a dedicated module within the Capture app, perhaps working towards PQS certification, integrating and providing possibility to integrate with other sensors, not to be locked in. We're not necessarily promoting solely this one sensor. There may be that other sensors are used in other contexts, and we should allow for integration with those. And then, as I mentioned, also alignment with other tools and seeing how we can add and adapt to the landscape rather than coming with competing solutions, but seeing where is there a gap and where can we best leverage the use of this tool and DHIS2 in general. So I'll stop there, and I look forward to the discussions, and feel free to contact us at any time. We're always very open and eager to speak to others that have interest in the subject matter. So thank you again.
Okay, thanks very much, Breno, and thanks, George. Again, if you have questions specific to DHIS2, you can put those into the Q&A function of Zoom, and we will answer those questions very, very shortly. We'll try to answer as many questions as we can, but we'll do that very shortly. We'll just cover our last topic for the webinar, which is data triangulation. So we've seen the data tools that can help us to manage our cold chains and our vaccines, and some of the data that those systems help us to collect and manage to help with decision making. So let's turn our attention back to the topic of data triangulation, which you saw in a previous webinar, and it's sort of an ongoing theme throughout this whole webinar series. So you'll remember the concept of data triangulation, which is the synthesis of two or more existing data sources to address relevant questions for program planning and decision making. And I'm sure that you've used data triangulation in your work. You know it requires critical thinking skills and some basic analytical skills, but the activity goes beyond making graphs. It's really about turning data into reliable information for action. So let's think about how we might use data and information about our cold chain to provide insights into our vaccine management and using this information for action. And we've already seen a few examples from the two presentations about some examples of data triangulation, but let's think, for example, we can think about cold chain equipment status and immunization rates. If we look at data on cold chain equipment functional status and compare that with immunization rates, we might determine that cold chain equipment outages directly lead to lower immunization rates. In this case, we might think about revising our cold chain equipment maintenance plan, such as by introducing a procedure for getting an emergency repair outside the normal schedule. Another one we can look at and compare data on closed vial wastage and cold chain equipment. If we see higher levels of cold vial wastage, we could compare it to our cold chain equipment status and see what portion of closed vial wastage might be due to cold chain equipment malfunction, or if it's due to other reasons, such as expiry. Different causes of closed vial wastage will give us different actions to take to address the problem. We might also compare cold chain capacity and coverage to see if limited cold chain storage capacity limits the coverage you can achieve. And we could also compare temperature alarm rates against adherence to the maintenance schedule. That's an example that DHIS2 brought up. As a real-time example, in Mozambique right now, there is a national level stockout of Penta, and the numbers of children immunized has dropped steadily over the past couple of months. In fact, it's heavier in some provinces than others. Knowing the stock situation can provide insight into coverage. So those are just a few examples of data that can be triangulated. If you have other ideas, please feel free to share them with our colleagues using the chat function. And that's the end of the formal presentation. So we have roughly about 12 minutes for a few questions. We will take questions that have already been posted in the Q&A, and actually some of those have been answered in writing, so you can refer to those and we'll share those with you afterwards. But let me invite each of our guests to let's start with maybe 3 questions each. Matt, can you choose 3 of the outstanding questions and respond?
Sure, thanks, Greg. The first question from Philippe is, asking if collecting data is challenging to convert it into action, and what if the system was not strong enough to implement the actions? Could this lead to fatigue in sending accurate data, and what is your experience? Thanks for the question. I think, from the pilot, the feedback we got from the users was there was not any fatigue. And I think part of that was because the data flows not just up to the central level, and it's not just reporting data, but it's also visible at the user level. So that syncing up and down, the bilateral syncing keeps it's not, the data is available at your fingertips to act on, and also track to see how long responses have been. So the visibility and just kind of building data sharing and the culture around that has kept the engagement pretty good. I think as time goes on, if we see issues that are not being resolved in a timely manner, that leads to a deeper analysis of, is it because of the users, or is it because of the system where maybe the spare parts aren't available, or the service provider is not responding to the warranty? But at least it's accessible to everybody in the same data. So so far that has not been a challenge. The next one was just from Shanjalal. It looks like, is the app free? Approximate cost involved in initiating and sustaining the application? It is open source, as I replied in the text chats to some people. The cost really depends on the size of the project, not necessarily for the servers and things like that, but really the deployment in terms of the number of users and if devices are going to be provided, training everybody and having good supervision and management to build a good data-driven culture, but also syncing data too, right? So if there needs to be Wi-Fi access, or if the program wants to invest in mobile devices that have cellular data, who's paying for that? But to get a more accurate estimation, we need to have a couple more deployments to kind of trend things out, but also the scale and size. So if you want to email me, we can definitely explore that with you more. And the last question is, how is from Junaidu, is how is the CCIS different from the WHO IGA tool that they just released, which is an Excel, or it's actually web-based now, but tool that allows you to input a lot of data from the inventory and gap analysis tool and do similar analysis. The data is designed to be interoperable, and we've been talking with WHO about how if someone has an inventory in CCIS, how we can export that or import it into the IGA application. A lot of the fields are being designed so that they are complementary, so that there's not recreating or variances in what a data element looks like. So in terms of that one, they are the IGA tool kind of helps map out what are the gaps or what are the needs, but this is more designed to be active and day-to-day, week-to-week management of the cold chain versus entering all the data to get kind of the outputs for planning. But again, like I said, the goal as we're working with WHO on this too is to make sure that you can push the data back and forth. So if you have a good inventory within the IGA, we could also then use that to build the foundation for the CCIS if a country wanted to deploy using that data. So those are the three I pulled out there so far. And if the other ones I'll try to get to in text, or please feel free to, again, email any questions as well. Thanks, Craig.
Okay, thanks, Matt. Can I throw it back to Breno and George? I see that you've already answered a couple of the questions in writing. And there's the question that's here, how to ensure government NMS takes this over, et cetera. So maybe they don't specify, I don't think, which system they're talking about, but could you maybe comment on takeover by the government or handing over?
Yeah, sure. I can comment on that one. And I think this is then part of the open source approach that DHIS2 has had and has built up over many years. So oftentimes, if we talk about one of these 60 countries, which I mentioned in the beginning, in the intro, which have already implemented DHIS2, they have in principle the infrastructure. So they have server instances, they have trained staff. We recommend that they have a core team that configures, maintains, and supports users. So that entire infrastructure is existing for all of those 60 countries. I mean, the level of development, the maturity, that's another question, but they will have in principle a working frame or a foundation that we can build on. So then the question becomes, how much more expensive will the cost of the sensors be? And again, we focused on a sensor which was performant, but also affordable. How much is the training for the users and the system administrators be? And then how can they maintain this over time? And generally, this is, again, a advantage and a lower threshold, I think, for leveraging, and that's a word I use often, the existing implementations of DHIS2, where we build on existing infrastructure, competence, and knowledge, and simply we're adding a module, in essence, to what is already being used. That's to that question. And if I can take one more.
Sure.
There was the one related to, I answered it in writing, but I just wanted to reiterate that so George and I have been working as dedicated LMIS resources at the University of Oslo since the beginning of last year. And our work really started with conducting this both internal and external landscape analysis of LMIS in a broad sense, and then developing a best practice approach and a position for DHIS2 to develop certain features which would complement as best as possible. I mean, how much we've succeeded or not is for you to judge, but we've attempted to find a gap which we could leverage the use of DHIS2 to fill, both when it comes to data capture and then analysis. Somebody mentions also, how do you lead to action and have this corrective action coming from the data being captured? So really, this is the focus that we've tried to have with these different projects, is how can we find an existing gap? And then we've reached out to a lot of the partners. We're still reaching out, and we'll continue to sort of cultivate this very open approach where we want to hear both also criticisms about what is it that we're maybe overreaching, what does the system not meet when it comes to requirements, and how can we best fit into this existing landscape. So we've had very much a kind of open and inclusive approach. And then from that, we've tried to develop a clear and specific path for development. And that's a never-ending job. We'll always be needing to sort of reevaluate and see where we fit in and how things have succeeded or not, and how can we best continue to develop.
Okay, great. Thanks very much. We have just a few more minutes. And Matt, I see that there is a couple of questions about CCIS. Is the data being collected and reported by MOH, or is it a partner? And is it interoperable with other systems like Imbrana of Ethiopia? Would you care to comment on one or either or both of those?
Sure. I do not know what the Ethiopian system is, so I cannot comment on that. But please, if you want to send me an email, I can research that for you. In terms of the data collection and ownership, Uganda wanted to keep it all on servers in country. So rather than using cloud-based AWS or Azure cloud storage, they have all their servers stored within the National Medical Store, and have a team that we train. Again, the 8 NMS ICT staff are able to manage, maintain, and support the server side of it, as well as some of the light hardware Android device support, as well as all of the super users were briefed on basic troubleshooting. So it is MOH owned and supported, and going forward. Yeah, thanks.
Okay, thank you. There's another question that was just put in. How do these independent efforts affect the global efforts to break silos and move towards a more collective solutions development to increase effectiveness? And I see, Breno, looks like you're typing an answer. Would you care to comment? Sorry, I don't mean to put you on the spot.
First, I will not repeat what I said about the open approach. I mentioned that a few times already, but the second point there that's relevant is that we tried to then have good dialogue with both these standard setting organizations like WHO, which Matt has referred to multiple times, which is very important to understand their approach and the work that they're doing at that level. And then the other is the large donor community, which then funds these non-aligned initiatives. So it's for them as well to have a aligned approach and to sort of define which direction are we going in, and not necessarily create this siloed approach. It's not to say that we don't have responsibility in that, but it's I think through communication with both the standard setting organizations and the donor organizations to then be able to organize ourselves and not create overlap or have overlapping initiatives, which just lead to more siloed solutions.
Okay, great. So thanks again very much. I see there's actually a couple of questions in the actual chat, not the Q&A. So maybe 30 seconds if we can get an answer from either Matt or Breno or George, if you'd like to comment. How do we ensure accountability on vaccine management is fully implemented? Anyone care to stab at that one?
Yeah, I don't know that it can guarantee, but having data visible to not just the people it's reporting up to, but also to the users, I think is a helpful way to ensure some accountability, right? It removes a little bit of that need to do the tracking and follow up if we can just look on a dashboard and see if all the districts or if all the users have reported or been active. And having that visible to other people too can lead to a little bit of that just building the culture. But I think it's more of a management question than a systems answer, in my opinion.
Okay, thanks. And I think I would tend to agree. Maybe the last question, we have maybe 30 seconds. Is this landscape something that can be shared? And do you reach out to private sector as well as NGO or traditional maybe partners?
I think I mentioned that landscape analysis, so I can take that. The landscape analysis that I referred to was an internal report, but I think what you could easily find is a great report from UNICEF, actually, who has at least one, if not several of these analyses, and they have really, we came to the same conclusions more or less. I can try to find that specifically, and maybe we can share with the participants after. And then we definitely reach out to any partner working within the field. I mean, if it's academic, NGO, ministry, or so on, I mean, those are all, we're welcome to speak to all of them. There's great solutions from the private sector and others, so that's always great. I think the ministry is also always our key, let's say, client, to put it in those words, but we reach out to as many different partners as possible. It only helps our perspective.
Okay, great. Thanks very much. We're coming up on the top of the hour, but let me thank everyone for your thoughtful questions from our participants and, of course, our panelists who provided both written and verbal responses. Thank you very much for that. If we find any questions that were asked that we could not cover, we'll try to do that through another means following the webinar. So before we close, we just want to remind you again of other cold chain equipment and vaccine management tools that were referred to in our earlier webinars. Here is a listing of some of those tools, and we'll share the links to these resources in the post-webinar follow-up email. And finally, here's a reminder of a previous webinar that we did on cold chain equipment and a reference to another webinar series that was presented by TechNet. We'll share these links with you as well. So that's the end of the webinar. We continued the topic of data use for vaccine and cold chain management by focusing on the two tools, CCIS and DHIS2. And then we also tied that back to the previous discussions on data triangulation. You'll be receiving a follow-up email with additional resources, the recording of the webinar and the slides, and I'll also be sending an evaluation form that you can complete to help us improve future webinars in this series. We hope that you'll be able to participate in the next and final webinar of the series, Data Use in Coordinated Supply Planning at Country Level, which will take place on May 17th. As a reminder, anyone who attends 5 of the 6 webinars in the series, either live or watching the recordings, you'll receive a certificate of participation. Let me also take one final reminder to thank our guests for your great presentations and your answers to the questions. And also, I would like to thank everyone for the very, very valuable work that you're all doing to ensure cold chain equipment maintenance and management and vaccine program implementation and supply chain management. So thanks again to everyone. Please enjoy the rest of your day.